Good day. I'm Sharon Spicer, and I'm pleased to present the PEAS project on behalf of the team in Alberta. The Pediatric Eating and Swallowing Project is a provincial quality improvement initiative with the purpose of developing clinical pathways to standardize and improve the care of children with a pediatric feeding disorder, as defined by Godet et al. In Journal of Pediatric Gastroenterology and Nutrition in 2019. Our target population is children in the ambulatory care setting. This project began with 2 World Cafes conducted in northern and southern Alberta, with the goal of determining from multiple stakeholders, including patients, families, dietitians, nurses, pharmacists, social workers, administrators, amongst others, what was currently working and what was not working in the care of children with pediatric feeding disorders in our province. These were the major themes that were identified at the World Cafes, and these were similar in their frequency across the entire province. The top concerns can be roughly grouped as relating to access to care, roles of care providers, and knowledge in the field. These were identified using the theoretical domains framework as candidate areas to target in our quality improvement implementation approach, and plans I am going to present some of our progress so far in 3 key areas. So our first step was to determine the current state of care being provided in Alberta for children with pediatric feeding disorders. Our overall goal here is to develop a referral directory of providers and to measure efficiencies over time. These are crude estimates across the province of the number of children likely to seek medical care for feeding and swallowing problems, based on estimates in the US that suggest this is 1% of children per year, and the reference for that is shown on the slide. We are able to get information on the time for a new referral to be seen in each part of the province, as shown. These are the wait times to get instrumental assessment. This is the estimated dedicated ambulatory full-time equivalency of feeding and swallowing providers, including occupational therapy, speech-language pathology, dietitians, nursing, physiotherapy, psychology, and social work. Overall, we have identified major challenges that include long distances to travel, the small number of highly specialized staff, difficulties for staff in maintaining competency given low patient volumes, and the highly variable mix of available services making up teams across the province. Moving on to knowledge, we have developed a provincial guidance document for the care of children with pediatric feeding disorders. This was developed by adapting, with permission, a guideline published from New South Wales in Australia. An example of the type of resource contained in this document is shown here for initiating enteral nutrition support, and here for the utility of instrumental assessments. These are some examples from the World Cafe of the issues concerning families and care providers around role clarity and communication. You can see that there were concerns about understanding who provides what services, services occurring in silos, and lack of multidisciplinary care. We have developed a consensus document that addresses roles as shown here on the left, remembering the multiple different care providers, their different training and skills, and the central role of the family in multidisciplinary care. We have clarified that individual scope of practice is determined by ministerial regulations, professional regulations, employer policies, and individual competence. We are developing a collaborative practice toolkit to help teams address areas where they feel roles are overlapping, where gaps exist, and where communication is breaking down. All of these resources have been brought together in a user-friendly website available for patients, families, and providers. This includes written materials and videos, basic training, tools, and forms. I will show here some of the key performance indicators that we have developed. In conclusion, the PEAS project is a province-wide initiative to address local stakeholders' concerns about the provision of feeding and swallowing services in Alberta. We have identified and addressed gaps in access. We are identifying and addressing current conflicts around roles and responsibility and ways to improve communication. We have created a clinical practice guide and implementing that into practice. And we are evaluating impact on key performance indicators over the next 2 years. We are well down the path of addressing concerns raised in regards to access, roles, and knowledge. Thank you. I've been happy to share about our PEAS project.